Welcome, everyone, to the Vox Box here in the European Parliament in Strasbourg and this EPP Group talk on healthcare. How the group has helped to make healthcare, public health, a European priority through different initiatives, including the fight against cancer, successful vaccine development, a subcommittee on public health, among other things. And the European Commission is working on a pharmaceutical package, taking into account what we learned during the COVID crisis, some mistakes we made, but also good things we did. And what would the EP groups like to see in this pharma package? Joining me is Dolors Montserrat, MEP from Spain. Welcome, Dolores.
Thank you.
You're on the Committee on Environment, Public Health and Food Safety, also the Subcommittee on Public Health,
Exactly.
right? And on the Special Committee on the COVID-19 Pandemic Lessons Learned. You're the lead author on that report. We want to ask you about that. And joining us virtually from Barcelona is Nuria Mas, Professor of Health Economics at IESE Business School, University of Navarra. You were on the Advisory Committee on Healthcare Systems for the government of Catalonia. Let me begin with Dolores, and as we mentioned, you're the lead author on that COVID Special Committee, Lessons Learned, and that report is to be voted on in June. What are a couple of key lessons? I mean, there are many of them, right? But give us two.
The European Union must act in one, so we have to be together because a pandemic doesn't know borders, so we have to be united. And
which we weren't always during that COVID crisis.
Yes, so I think so that the big successful of European Union was that we've been united with pandemic.
Yeah, and when we did that together, like for instance on buying vaccines.
Exactly.
That worked.
We invest in a vaccine. We did a global joint procurement with all European Union, so with all the 27 state members, and then we did a massive vaccination for all the European citizens.
Yeah.
And in the same time, because we have one of the most important values in the European Union, that is solidarity. So we export the vaccines from Europe to the rest of the world.
Right. Now, where it didn't work, for instance, and I remember you telling me this story about Spanish doctors having to wear garbage bags to protect themselves from COVID. You have another horror story like that for us?
Yeah, for example, we had a shortage of a medicine that we need that medicine to intubate the patients during the COVID time. And we had shortage not just in Spain, I'm talking about all Europe.
Yeah.
So this is the importance that European Union has to be prepared for the future. We don't know the next health emergency, the next pandemic. We don't know what is going on.
Yeah.
But we have to be prepared. So we have to produce in Europe about drugs, medicines, APIs, masks, everything that we need.
Now, let me jump over to Nuria. Hello, Nuria, over in Barcelona. Good morning. Buenos dias. Do you have maybe a quick horror story to tell? I mean, you inspected hospitals for a long time for Catalonia, though now you teach at the university. But do you have another story to tell during the COVID crisis?
Yes, we could have tons of horror stories that we can only imagine, but I also think we have amazing success stories, which is also the fact it has to do with what Dolores said at the beginning, working together. And second, something that I learned, if you have the talent, if you have the professionals, then these people who know what they are doing, they'll find the solution as quickly as possible. So that's why I think it's so crucial that Europe is the place where these talented people and the companies that we need want to be.
Okay, now, what would you like to see the EU do more on healthcare, being sort of an outsider and independent in this sense? EU Commissioner Kyriakides recently set out priorities in a recent speech that I read. She talked about access, incentives, addressing shortages, sustainable healthcare, combating microbial resistance, leaner regulatory environment. What priorities do you see? All of the above, or do you see others?
Well, it's hard not to say all the above, right? But I think that what we need is to bring this into practice. So have a very clear strategic direction where these priorities can be achieved. And to me, this means mostly three things. The first one It's to make sure that we attract the talent that we need in healthcare, mainly R&D and professionals.
Okay.
Second, that we attract the production here, and Dolores also mentioned the importance of security. And third, that we can leverage unique things that Europe has that nobody else in the world can have.
Like
so
what?
Let me just
like
say,
what? Yeah.
Exactly. So we have two of them. One is our healthcare system is much more integrated than anywhere else, and we've been collecting data from our citizens and our patients for a long time. If we bring it all together, if we can create this European health data space, that's unbeatable. I think that's unique. And the other thing is that for competitiveness, the solution for Europe is R&D. And if you look at the R&D report, most of the R&D comes from healthcare in Europe. The first one is automotive. The second one is healthcare.
Okay. And a lot of this has to do with incentivizing, right? I mean, how do we incentivize? Let me come over to you, Dolores, on that.
Well, we need, we have an important and competitiveness industry in Europe, but we need less bureaucracy, for example.
Okay.
When EMA, the European Medicines Agency, approve a drug, we cannot wait 1 year, 2 years, or 3 years to put that drug that is approved by EMA in one of the 27 state members.
The national governments have to follow that.
Exactly. So this is the reason that we put in the pharmaceutical strategy maximum in 6 months after EMA approve, the countries, they have to put that drug in their markets.
And that gives more predictability also for the industry.
And we're going to reduce the gap of the access, because you can find in Europe that one patient on cancer in one state member has to wait 1,000 days for that drug, and another country 9 days. In oncological drugs, we have a big difference between 9 days to 1,000 days. So we have to reduce this gap.
Yeah, and you've spoken of shortages of paracetamol, for instance, during the pandemic. How do you ensure that security of supply? Is this the way to do it?
Well, for me, it's very important to ensure the European Union needs to increase our production in Europe, boosting its industry, of course, while at the same time diversifying its supply chain and ensuring better coordination of national health systems. So for me, one of the most important points is EMA. The vaccination, it was an example. When EMA approved the COVID vaccine, the day after, all the state members, they approved that vaccine. So why we cannot do the same with all the drugs? I'm thinking with the rare disease, for example, we have one patient in one country and they have to wait 3 years, and perhaps in another country they have to wait 1 year. We are European Union, so we have to build the European Union for health. That means that everybody will have the same access in the same time with innovative therapies.
So that should be in the pharmaceutical package.
Yeah,
that's what in your dream of vision.
Yes,
we hope to see that.
Yeah, we hope.
Nuria, anything to add to that on the pharma package?
I absolutely agree with the priorities that she says, and I would just add there's one fact: our companies can locate anywhere; they can choose. So we just need to make Europe attractive for them to want to be here. And when we talk about the access, it's the same. Coordination is crucial. All the points that she has said will help, but at the end, there's the financing as well. So sometimes, the fact that something has been approved does not mean that we can finance it easily. So I think that for this to become real, we need to think about how the states will be able to afford that. And that requires improving inefficiencies in healthcare and, going one step further. Of course, this is a super good step, but I think we need to step further as well.
Okay, good. Let me move on to the special committee on, on the special committee, you're going to come out with that report. Can you give us a little bit more on that, on what you aim to have in that report?
Well, perhaps 3 things, but first of all, I want to focus on the cyber attacks that they are suffering our hospitals all around Europe. For example, Nuria is from Barcelona, and I'm from Barcelona too. And just 3 weeks ago, 1 month ago, one of the biggest hospitals in Barcelona, it was attacked by a cyber attack. So we had to suspend 300 operations, 4,000 analyses of people, and we had to move patients from this hospital to other hospitals.
Right.
Can we imagine, are we prepared? We have to be prepared for a global cyber attack in our hospitals in Europe? I hope so, that it's not going to happen, but we have to be prepared.
What was that, ransomware that it was involved there?
Well, the thing it is that in the report, we want to be prepared, all the state members and the European Union, how? So the health sector has to be one of the pillars of our European Union strategy of safety and defense.
Right.
This is one of the best lessons that we learned with COVID.
It's critical infrastructure,
yes,
right?
Exactly. So it's
important,
defense and security strategy now, the health.
Right, right. Okay. What about incentive mechanisms? I know, Nuria Mas, you're pushing in that direction toward incentives. How do you incentivize doctors and hospitals to perform better?
Well, I think that the first important stuff in here is to be clear on what we want. And what we want, it's the best possible health for the resources that we have. So that's, for me, it's very important that we can think more in terms of paying for outcomes, paying for value-based healthcare, as opposed to, I don't know, let me give you an example that we work on. So if I want you to reduce waiting lists, that's a very nice objective, but that's not the final objective. The final objective is that people are, are taken, are well taken care of, right? So if I pay you, if I incentivize reducing waiting lists, this might end up with hiring more doctors. But that's not necessarily the best thing that we might do with our resources. Maybe it would be way better that we get patients who don't get readmitted into the hospital, who do preventive care, and so on. So for me, when you think about incentive, first you need to know exactly the final objective. What do you really want? And then understand the pathway, the patient pathway that will take you there.
Yeah,
understand which role everybody plays.
What about the patients themselves? How do you incentivize them?
So, yes, we worked on that as well, and patients really need to take more and more a proactive role onto this. An important part is education, but that's not getting us very far. So there's the nudging. Nudging, for example, you can use copayment. Copayment can help up to some point only. Only up to some point.
Right, right. To what point does that help? Obviously, if there's copayment, that means they have a stake in it, in making sure that they use healthcare properly, right?
Okay, so the first thing is that, let me say a disclaimer here, because I'm not very keen on this, in this copayment in particular, okay? But 80% of the population use most of the resources. If we put copayment, and obviously we want to protect access, we will need to cap it anyway, which at the end means that for most of the people, copayment will not be binding. It will not apply to them. So that's why I'm saying it's not helping that much. Now, let me say other ways in which we can get people to do the right thing. Okay? If I want you to go to primary care and not to emergency care, I can do it through payments. I can charge you more if you go to the emergency care or to the private care, or I can do it through time. I can make it very hard for you, if you are not really sick, to, access emergency room, for example. So there are different ways.
Right, right. I mean, Dolores, I imagine that's a sensitive issue, right? Because that means patients having to pay. So how does that work? How do we use that to make healthcare more effective?
Look, one of the big instruments that the European Union for Health put on the table, and I think so that it's going to be a big change and a big opportunity for patients, for scientifics, and for the industry, and for the public health systems, it is the the big data health space. So Europe, we're going to have the 400 millions of your health data. Of course, that we're not going to have your name, but we're going to have, for example, a patient that has 49 years old. Her mom had breast cancer when she was 44. For example, I'm obese. I have diabetes. So all this data, it's going to be inside of just one big data in Europe, and we're going to use the artificial intelligence, and it's going to give us a lot of data to promote the health, to prevent the disease,
Yeah.
to be more quick, well, to focus on what we have to invest in the innovation and research.
Including rare diseases.
In rare
If we
diseases.
can put
So
our heads together on
it's
that.
going to give a lot of information
Yeah.
that it's going to change, the paradigm. It's a new paradigm that is going to help so much for the sustainability of our systems
Right.
and, of course, to have access to all treatments.
But also anonymity is very important there because I think people need to be reassured that their data is going to be safe.
Exactly.
As far as that goes.
Exactly.
I'm so sorry, but we're running out of time. I want to however, cover that subcommittee on public health.
Yeah.
To get both of your inputs on that. That is something that the EPP Group was instrumental in making that happen. Nuria, how much do you see that as an opportunity there to focus on public health? Because that's pretty much your sandbox, isn't it?
It is, and actually, with the data that Dolores was mentioning, since health is this critical infrastructure, that's where we have most of, the possibilities of advancing on. And there's something that we have learned in a project that we did with some researchers in Berkeley. That is, first you need the data. Data is the one; it's key.
Yeah.
It's the one that tells you what works and what doesn't. So we need to have the data there, analyze it, and make the most out of it. The second thing that we need to do is to bring the big headlines and then allow for local ways of organizing this. Different countries are very, very different.
Right.
And there's a lot of richness in there. Let them organize this public health in the way in which is going to work better for them.
Yeah.
If you are very rural, you need to do something that different from if you are very urban. If you have lots of mental health hospitals, that's going to work different than if you have something else. So
Right.
also appreciate the local differences across countries and in one country to make the most out of this.
So
because there's a lot of background in the way in which every country has organized healthcare, and that's very cultural. You cannot change that easily.
Yeah, can we get final word from Dolores about that public health subcommittee to give sort of a direction and orientation, and yet that there still be sort of autonomy on a local level?
Yeah, well, the first thing is that we feel so proud to achieve this subcommittee of health. It's the first time in the European Parliament that has the European Parliament a health committee. So what does mean? That the health now is a priority for European institutions, has to be a big priority for the state members, and of course we are putting again the patients and the European citizens in the center of our policies.
Good.
So never again what happened at the beginning of the pandemic.
Yeah.
We have to be prepared, we have to put the patients in the center of our policies, we have to find solutions for all the disease, and third, we have to defend our universal public health systems in Europe. How to maintain the sustainability of our health public systems.
Yeah.
So this is the reason that it is a good news and a good successful for EPP to achieve this subcommittee of health.
I hope we have time for a quick lightning round. How ready are we for the next public health crisis, Nuria?
We are much readier than we were before because we've learned lots of things and we are putting the elements in piece. And I think this data is going to play a very important role. And second, the talent. We need to make sure that we keep the people that are going to get us out of it here, right? It's very important that we can remain this very attractive place for professionals, for researchers, because when the pandemic comes or whatever thing comes next, we won't see it coming by definition.
Yeah,
and that's when the talent is going to be crucial.
Indeed. Dolores, quick word. How ready are we? How can we reassure the public that we're ready for the next one? Or readier?
We are prepared and we are putting the patients and all the European citizens in the center of our policies. So I want to give will to all the European citizens that now they are suffering some disease.
Dolores, thank you very much. Also, thanks to Nuria and thanks to all of you for watching this EPP Group talk on healthcare. Keep in mind, eppgroup.eu for more information, also on the social networks at EPP Group. My name is Chris Burns. See you next time.
Thank you.